Something that Dr. A and I do mention on the podcast is the IC diagnosis and what I believe falls under that umbrella. So IC is a bit of a cop-out diagnosis in itself. It basically means bladder pain with no known cause. That's why I'm so hell-bent on saying I've got interstitial cystitis caused by chronic UTI, or I've just got chronic UTI, because I know the reason for my bladder pain. I know the reason for my IC. IC is just kind of the label they slap on it when they don't know what's causing your pain, and they also don't care to try and help you fix it. So we talk about in the podcast the IC umbrella, as I like to visualise it. Then under that umbrella, there are things that could be causing that pain, like chronic infection, chronic embedded infection, some people call it, histamine problems, hormone problems, Hunner's lesions. There are obviously some sinister things as well that could be causing bladder pain, but chances are if you've been diagnosed with IC, they would have ruled out bladder cancer. But there are a number of things that fall under this IC, painful bladder syndrome umbrella. And I think it's so hard because patients are left on their own to work out what part under that umbrella that they fall into. I talk about it for the first time on the podcast as well, the fact that I believe that I fall actually into a few of those categories, but my main issue that caused my daily life-changing pain was infection. I definitely have a histamine response in my bladder. I definitely have hormonal flares as well. So it's normally finding the pieces of the puzzle for each patient. But then again, you've mentioned something that we all immediately come to a roadblock with: GP, not interested. That's why you've got to do your own research, you've got to advocate for yourself, you've got to find the specialists in each one of those areas that you believe you might fall into. Another one I just thought of, pelvic floor dysfunction. There are so many things that could be causing this IC pain. It's just a lot of work to find out which one it is.